Good morning, friends. Look at first few diagrams before I go to the subject proper. Look at this diagram. What is it showing? It is the X-ray of chest. This X-ray of chest, you see this black portion and this black portion. See? And then in between you see this white portion. Okay? Now, in the X-ray, the air looks as a black shadow. Air gives a black shadow, whereas fluid or any other solid structures will give a white shadow. For example, bones will give white shadow. These are the ribs. You can see them as a white shadow. This is the backbone. You can see as the white shadow. And this is the heart. You can see as the white shadow. Right? This is right up to this place. But lungs have air, therefore they are looking black. So be very careful in understanding this thing, that the air looks black in the X-ray, whereas other structures look as white. Look at another diagram to understand the chest. Look at this. This is the normal lung, but this is the windpipe, and this is the other lung, but you see how much smaller in size this is. And this lining, see this lining, this is the thin covering of the lung, and this is, since this has two layers, this is the outer layer. The inner layer is adhering to this lung tissue. Between these two layers you find this is the fluid. This is called pleural effusion. See this is the lung which is collapsed, and this is the fluid, and this is the outer layer of the outer thin layer covering the lung. See another diagram. See another. This is also X-ray chest. This is the heart. You see, and this is the heart, and this portion marked is the right border of the heart. This is the right border of the heart, and this area is white. See, this is black area. This is black area. As I told you, that black area is normal because it contains air. It causes a black shadow, and this area has become white, and this is the abnormal area. We are not seeing here diaphragm. It should have been here. This should have been the diaphragm, but we can't see the diaphragm because it all has become white. But here we can see this separation between the chest and the abdomen. This is the left diaphragm, the right is not visible, and this all area is white. दोस्तों इसको ध्यान से देखो, ये वाइट एरिया जो है ये abnormal है, ये ब्लैक एरिया एयर के कारण है जो लंग्स में नॉर्मली प्रेजेंट होती है, इसलिए ये सारा नॉर्मल है. यहाँ से यहाँ तक ये सारा लंग है लेफ्ट का, और ये राइट का लंग है, ये नॉर्मल है. पर इसका निचले हिस्से में ये सारा वाइट हो गया, ये एबनॉर्मल है. यहाँ हम हार्ट का बार्डर देख रहे हैं, लेकिन नीचे जैसे इधर डायफ्राम देख रहे हैं, ऐसे इधर का डायफ्राम हमें दिखाई नहीं दे रहा. इसको हम कंसोलिडेशन कहते हैं. कंसोलिडेशन का मतलब होता है किसी चीज़ को इकट्ठा करना, यूनाइट करना, एक दूसरे के नज़दीक लाना, कंसोलिडेट करना. इंग्लिश हिंदी में कंसोलिडेट वर्ड ही यूज़ किया जाता है. एक और डायग्राम आपको दिखाता हूँ जो आगे चलकर बड़ा समझने में काम आएगी. इसको देखो, ये सारा ब्लैक एरिया है. यू नो इट इज़ नॉर्मल लंग, ब्लैक एरिया. This is, you are seeing this white area. This is spine or backbone. This is also, you know it very well. But what is this? You see, this is small structure here which is showing blackish shadow in between this one. This is the windpipe. This windpipe are also called trachea. दोस्तों ये windpipe है, इसमें हवा है, हवा के कारण ये ब्लैक दिखाई दे रहा है, पर इसको यहाँ होना चाहिए था, इस जगह सेंटर में, लेकिन ये इतना शिफ्ट हो गया इधर. ये क्यों शिफ्ट हो गया? क्योंकि ये जो लंग था इसमें जो एयर थी वो यहाँ से डिसअपियर हो गई है, वो यहाँ से हट गई है, चली गई है। तो उसके जाने से क्या हुआ, जो लंग फैला हुआ था वो सिकुड़ गया। उससे सिकुड़ने से क्या हुआ कि इसका विंड पाइप इधर पुल हो गया। सो ये सारा जो एरिया है इसको हम कंसोलिडेशन, इसको हम कोलैप्स कहते हैं कि लंग कोलैप्स कर गया। कंसोलिडेशन इसको नहीं हम कह सकते क्योंकि इसका जो इसने विंड पाइप को अपनी तरफ खींच लिया। कंसोलिडेशन नहीं अपनी तरफ खींच सकती, कंसोलिडेशन में एयर निकल जाती है, उसकी जगह फ्लूइड आ जाता है। लेकिन यहाँ जो है एयर चली गई है, लंग का साइज छोटा हो गया, लंग का साइज छोटा होने से ये विंड पाइप इधर पुल हो गया। सो फ्रेंड्स, this is the case of collapse where it has pulled the windpipe because collapsed lung is smaller in size, and therefore the extra space has created a pull on the trachea, that is windpipe, and pulled it to this side. Now friends, it is an incidence of 20 years back when a regular patient of mine telephoned me at about 9:30 in the night that his mother is having problem. She is having fever and difficulty in breathing. I told him to bring her to the hospital, and it was about a distance of 100 kilometers. So he reached the hospital by about 11 in the night. Within half an hour I reached the hospital and I examined the patient. I found that she really had dyspnea. Her breathing was fast, and chest movements were also visible. And I asked the hospital staff to start oxygen inhalation and start intravenous infusion of dextrose saline. And I also asked to give the patient ciprofloxacin antibiotic 200 milligram in 100 ml intravenously, finishing the bottle in 1 hour, giving it twice daily. I found distinct improvement, but on examination what I found was that the right side of the chest was moving less, and there were certain signs on the right side, on the back. I would not describe this is medical part. There was bronchial breathing. Bronchial breathing is just as you are blowing in a pipe. That type of sound comes, that is called bronchial breathing. And that happens when the lung becomes solid. Then the sounds from the air passages are directly conducted to your ear or to your stethoscope, and you hear a different type of breathing. So this is a sign for the doctors. But as far as you are concerned, this patient had a consolidation, a sort of pneumonia, what you call. So we had a patient of LOBAR pneumonia. So I next morning asked for X-ray test, and X-ray test confirmed my diagnosis that this patient had LOBAR pneumonia of right lower lobe. So with the treatment, the patient definitely benefited, but next day she exerted by talking to the visitors and resulted in deterioration by the evening. So I strictly instructed them not to exert unnecessarily and just let the patient rest. Give me at least 3 days before the antibiotic takes its full effect. And then next there was no problem, but still the patient's son asked me that he wants to take a second opinion. So I said, you go ahead, you ask for any second opinion, but he asked me that you suggest. So I suggested him that one of my professors of medicine who was retired was available nearby. So he was called and he said that the treatment is very right, everything is fine, and continue the treatment, no extra investigation or care is required. Though in such cases, one important thing is that it could be a case of cancer of the lung, and such patients require bronchoscopy to find out if there is anything. I have already described a case of bronchogenic carcinoma, it is the cancer of the lung, जिसका मैंने बताया था आपको कि कैसे उसकी ऑपरेशन टेबल डेथ हो गई थी उस पेशेंट की. So you remember that case where patient died on the operation theatre even before he could be operated. That was the case of bronchogenic carcinoma. Here we have a case of pneumonia, and pneumonia we were to find out the cause. So we did consider that should we do bronchoscopy or not. We said there is no need for bronchoscopy. Patient is responding very well. So therefore we continue the treatment. By 5th day the patient was perfectly all right, and by 7th day I discharged the patient. And next 4 years of follow-up, the patient did not have any problem, and the case was thus sorted out. So friends, remember this case. This is a pneumonia, not cancer. This is not a collapse of the lung. It is the solidification of the lung. Pneumonia, that is the consolidation, is a solidification of the lung due to the inflammatory cells and some fluid in the lung alveoli. दोस्तों, लंग के जो एल्वेलाई हैं उनमें जो एयर सैक्स होते हैं उनमें इन्फ्लेमेटरी सेल्स वो भर जाते हैं और उसके साथ थोड़ा सा लिक्विड भी भर जाता है. उसकी वजह से लंग सॉलिड हो जाता है. सॉलिड होने से उसका जो एयर एक्सचेंज का मैकेनिज्म होता है वो ख़राब हो जाता है और उसकी वजह से पेशेंट को ब्रीदिंग डिफ़िकल्टी होती है और उस ब्रीदिंग डिफ़िकल्टी के साथ पेशेंट को ज़्यादा बढ़ जाए तो ब्लूनेस भी हो सकती है. पर फॉर्चुनेटली इस पेशेंट में ऐसी कोई प्रॉब्लम नहीं हुई और वो हमने पेशेंट को डिस्चार्ज कर दिया. थैंक यू वेरी मच फ्रेंड्स. Do remember to comment on these things. Please do not send me the thumbs up or these things, signs on the messenger. Messenger is just to give you the link. You just subscribe the channel. That will be a good thing. And if you will comment on the video, that will be a very, very positive sign. Thank you very much. We will meet next time with another interesting case.